Welcome to your Global Vision Support Services training module on crisis prevention and response. We're pleased to be facilitating this module for Global Vision Support Services, LLC. In the work we do, the ability to recognize, de-escalate, and respond effectively to crises is not just a policy requirement. It is the foundation of the safe, supportive environment we strive to maintain for those we serve. Over the course of this training module, we'll break down the essential strategies needed to handle challenging situations with confidence, professionalism, and care. Don't forget, there will be a test at the end of this module. Let's get started. Now let's move into the core of our proactive approach. Identifying crisis behavior. The ultimate goal of this training is to learn how to stop a crisis before it starts. Prevention is our most powerful tool. But to be effective, we must first have a clear understanding of what a crisis actually is. Often, a crisis manifests as an emotional event, a moment where an individual's behavior exceeds their ability to cope. This might be triggered by a radical change in a person's life, or it could be a crucial time where stress has reached a breaking point. Regardless of the trigger, it is a period of high instability, characterized by an impending change in the situation and, if not managed correctly, the risk of an undesirable outcome for themselves or others. Now, by identifying these signs early, whether they are verbal cues, changes in body language, or shifts in temperament, we can intervene before the situation escalates. Throughout this process, remember that maintaining a safe environment is our constant baseline. A safe space is one where boundaries are clear and potential triggers are identified, allowing us to navigate these volatile moments with the composure required to keep everyone safe. The focus and goals of crisis services. It's vital to understand this key distinction. Crisis intervention targets the response, not the event itself. While we cannot always control the external events that trigger distress, we have total control over how we respond. Because every individual experiences crisis differently, our intervention strategies and our approach to mental health support must always be predicted upon an accurate individual assessment of need. We are not providing a one-size-fits-all solution. We are providing support tailored to the specific person in front of us. Goals of crisis services. With that focus in mind, our work is driven by 5 core goals. First, we promote safety and emotional stability. Our priority is always the physical and emotional well-being of the adults and youth we serve. Second, we intervene early. By acting at the earliest possible moment, we aim to minimize further deterioration and prevent a difficult situation from becoming a crisis. Third, we build resilience. We help individuals develop or enhance their own coping skills and connect them with their natural support systems. Fourth, we bridge to care. We serve as a vital link to ensure they obtain the ongoing treatment they need. And finally, we advocate for the least restrictive environment. We encourage services in the least intensive setting that is clinically appropriate, ensuring that our support empowers independence rather than limiting it. Understanding causes and triggers. To effectively intervene, we must understand the why behind the behavior. A crisis rarely happens in a vacuum. It is usually the result of multiple compounding factors. We categorize these causes into several key areas: emotional and physical foundations. We start with the basics: stress, fear, anger, and pain, as well as both physical and emotional strain. When an individual is already feeling a sense of high tension, their threshold for coping drops significantly. There's also medical factors. We must always consider internal variables such as medication side effects or hormonal imbalances, which can drastically alter how someone processes their environment. Social and interpersonal factors. Often the environment plays a huge role. Crowded spaces or the presence of strangers can be overwhelming. Similarly, interpersonal struggles such as distrust, loneliness, relationship problems, or family dysfunction create a backdrop of instability that can lead directly to a crisis. What are trigger events? While those factors create the pressure cooker effect, we must also identify what we call trigger events. A trigger is the specific catalyst that initiates or precipitates a reaction. It is the moment the internal or external tension spills over into outward behavior. These triggers generally fall into three categories. Number 1, internal physical changes. This could be a sudden increase in heart rate, pain, or a physical sensation of illness. Number 2, internal mental status changes. This involves shifts in thought patterns, confusion, or a sudden change in how a person perceives their reality. Number 3, external or environmental changes. This could be a change in staff, a disruption in a routine, or a shift in the immediate surroundings. Learning to identify the specific trigger for an individual is how we move from reactive crisis management to proactive preventative support. When we talk about the internal drivers of a crisis, we must look first at internal physical changes. These are often biological or physiological shifts that lower an individual's ability to regulate their behavior. Some common factors include: number 1, basic needs. Unaddressed pain, fatigue, or hunger can severely impair judgment and emotional control. Number 2, substance-related factors. We must be alert to the effects of intoxication, the onset of withdrawal, or intense cravings, all of which create significant physical and mental instability. Number 3, neurodivergence. There's conditions like ADHD that can also impact impulse control and sensory processing, which, if not managed, can become a significant factor in a crisis. Internal mental status changes. Equally important are internal mental status changes. These are shifts in how an individual perceives and processes the world around them. This includes: number 1, disorientation. This can manifest as confusion or, in more severe cases, hallucinations and delusions. Number 2, emotional intensity. High levels of anxiety, depression, or an overwhelming fear of losing control can paralyze an individual's ability to use healthy coping mechanisms. Number 3, perceptual shifts. When someone experiences a perception of a threat or a psychotic distortion, they are reacting to a reality that may be very different from our own. Understanding these internal states is critical. because it reminds us that the person's behavior is often a response to what they are experiencing internally, not necessarily a direct reaction to the environment around them. External triggers and behavioral patterns. Moving outward, we must identify the external triggers. These are situations in the environment that can threaten an individual's sense of stability. These triggers often revolve around a perceived loss of control or standing. Number 1, loss of agency. This includes a threat to one's freedom, loss of autonomy, or loss of privacy. Number 2, performance and status. Fear of failure or the loss of a job can be incredibly destabilizing. Number 3, personal connections. A challenge to family or relationships strikes at an individual's support system. Number 4, obstacles. It's any challenge to an individual's personal goals or needs can act as a catalyst for a crisis. To better understand the psychology behind these actions, triggers, keep these 4 principles in mind. Number 1, threat response. Aggression almost always occurs when an individual feels threatened. Number 2, emotional resilience. Emotionally brittle persons are significantly more prone to anger when faced with stressors. Number 3, pattern recognition. Triggers are often repetitive for the same individual. Recognizing these patterns allows us to predict and mitigate future episodes. Number 4, proximity perception. It is critical to realize that persons who are angry often interpret physical closeness as a threat. Maintaining appropriate personal space is one of the most effective, simple ways to de-escalate a volatile situation. Factors of triggers. Finally, we must remain aware of the social dynamics and behavioral factors that can complicate a crisis, such as attention seeking. Some individuals may act out to gain attention from staff, using crisis behavior as a maladaptive way to feel seen or heard. There's also group dynamics. We must be vigilant in group settings. For example, individuals with a conduct disorder may conspire to have one client act out to create a diversion, allowing others to engage in prohibited behaviors or simply cause disruption. By staying mindful of both the individual's internal state and the broader group environment, we can maintain the necessary awareness to keep everyone safe. The phases of a crisis and escalation. Understanding the life cycle of a crisis helps us intervene at the right time. Every crisis generally moves through a predictable progression. Like the trigger, it begins with a precipitating event, the catalyst we discussed earlier. The perception. Next is the individual's perception of that trigger. This is a pivotal moment. If their usual coping mechanisms fail to handle the stress, they are pushed into the final phase. And then we have the crisis. This is the point of breakdown where the individual can no longer maintain their stability. Escalation. Our primary responsibility is to catch these moments during the escalation phase. This is the period where we have a window of opportunity to de-escalate the client and avoid the development of a full-blown crisis. We must be especially vigilant when a client is in a vulnerable state. This is often when something in the environment, a change in staff, a noise, or a peer interaction causes sudden emotional distress, or they are experiencing physical distress, such as pain, hunger, or exhaustion, which lowers their tolerance for frustration. By recognizing the signs of escalation early, we shift from being reactive to being proactive, providing the support they need before they reach that point of no return. Internal escalation. Now let's look at what we call internal escalation. This is the hidden phase. Before an individual acts out, they are experiencing significant internal turmoil that may not be immediately obvious, but which is driving their behavior. During this stage, a client may be experiencing deep-seated discomfort. They may feel a sense of unease within themselves or become increasingly uncomfortable with the environment around them. Or it could be perceived neglect. A client may feel that their needs are not being met, leading to frustration. Or it could be a perceived threat. Most importantly, they may feel threatened in some way, even if that threat is not apparent to us. Understanding these internal feelings is the key to catching a crisis before it becomes visible to others. While the distress begins internally, it almost always manifests physically. If you know what to look for, you can often see the escalation happening in real time through the person's nonverbal cues, such as movement. Watch for pacing or constant fidgeting, or vocal changes. Listen for an increase in volume, talking louder than normal, or rapid speech, or physiological shifts. Pay attention to rapid breathing and physical signs of high stress, such as veins protruding in the neck or forehead. These are your early warning signs. When you notice these behaviors, it is your signal to step in with de-escalation techniques before the situation progresses any further. The progression into active crisis. As we move into the external escalation phase, the signs of distress become impossible to miss. At this point, the client's ability to communicate effectively is severely impacted. You will see clear signs and symptoms of stress, anger, and anxiety manifesting in their body language and tone. This is the stage where staff and even peers can clearly see that the client is on the verge of acting out or losing it. Our goal here is to intervene immediately to prevent the transition into an active crisis. Internal active crisis. When we reach the internal active crisis stage, the individual's internal resources have completely depleted. They are experiencing a level of stress that is overwhelming. This is characterized by a cocktail of intense emotions: frustration, anger, anxiety, agitation, and a profound sense of hopelessness. In this moment, the client is no longer thinking logically. They are entirely consumed by the emotional storm they're trapped within. External active crisis phase. During the external active crisis phase, the internal breakdown becomes outwardly destructive. Communication is now entirely impaired. This phase often involves the following: volatile outbursts, such as screaming, crying, or physical aggression towards others, or self-harm or property damage. This may include kicking doors, hitting walls, or attempts to flee, or a loss of control. From an outside perspective, this is the point where the client is clearly viewed as being completely out of control. Active crisis phase. In the active crisis phase, our role shifts to immediate, decisive action. The client is emotionally stimulated, feeling utterly hopeless and overwhelmed. Our primary mandate in this phase is twofold. 1, de-escalate the client. Use all available tools and training to lower their emotional intensity. 2, ensure a safe environment. Protect the client, yourself, and others from harm. When a situation feels chaotic, your calm professional response is the anchor that helps guide the client back to a place of safety and stability. The crisis continuum and recovery. Post-crisis phase. Once the storm has passed, we enter the post-crisis phase. At this point, the individual will experience a significant decrease of energy. Their cognitive and emotional abilities may drop as they process what just occurred. This is a delicate time. While the immediate danger has subsided, our interventions must now focus on recovery and preventing a recurrence. Stages of the crisis continuum. Stable. To understand our workflow, let's look at the crisis continuum, beginning with the stable baseline stage. This is when the individual is functioning well and our response is entirely preventative. During this stage, we are doing the following: assessing strengths and needs and reinforcing the positives, fostering positive interaction and engagement, implementing early intervention strategies and developing a care team, connecting the individual with their natural supports, and crucially, we develop a crisis plan while they are stable. Though remember, this plan must always be initiated prior to starting services as a core part of the Person-Centered Plan, or PCP. Stages of the crisis continuum. Escalation. When we see signs of escalation, our response pivots to preservation. We maintain continued engagement while working to remove environmental stressors. We employ soothing techniques, active listening, and problem solving. We focus on reinforcing their strengths and teaching stress management or replacement behaviors. We ensure access to resources and perform ongoing assessment to refine our prevention planning. Stages of the crisis continuum. Acute. In the acute phase, the individual is overwhelmed and out of control. This may involve self-harm or harm to others, and in some cases, law enforcement may need to be involved. Our focus here is de-escalation techniques, providing safety planning, and offering the individual choices to help them regain a sense of agency. We provide close supervision and monitoring. We contact support persons identified in the crisis plan or law enforcement if there is an imminent risk. If necessary, we facilitate a referral to a diversion bed or hospital and engage in collaborative planning with the team. Stages of the crisis continuum. Stabilization. Finally, we reach the stabilization phase. As the person returns to their pre-crisis state, our work here includes continued de-escalation and careful debriefing and re-engagement, continued monitoring and support to ensure they remain stable, Most importantly, we reassess and adjust the crisis plan based on what we just learned, ensuring our crisis prevention strategies are more effective for the future. The Crisis Response Framework. Elements of crisis response. To effectively execute our work, we follow a structured crisis response model. This is a cyclical process that ensures we are always prepared, responsive, and learning. Engagement. This starts with preparing yourself mentally and physically, followed by active listening and observing. Assessment. We assess the situation and develop an immediate targeted response plan. Intervene. This is the action phase where we intervene to prioritize stabilization and execute our plan. Linkage and follow-up. We ensure the individual is connected to ongoing care, then review, reflect, and reassess the outcome to improve our future response. Prevention and planning. Proactive preparation is key. Ask yourself, what would you want to know before responding to a crisis? If a consumer calls you in crisis, there are specific pieces of information that are vital to have on hand. Think of 8 key factors, such as their medical history, known triggers, current medications, primary support contacts, and past successful interventions. Knowing these details before you ever pick up the phone allows you to act with precision rather than guesswork. Coping mechanisms. We all have ways we handle pressure, but it is important to remember that for our consumers, the crisis is the point where those personal coping mechanisms have been exhausted. Most people attempt to manage their own stress, but when those methods fail, the situation escalates. Our job is to understand their existing tools so we can help them regain their balance. Crisis response plan. When we draft a crisis response plan, simplicity is our best tool. The plan should be able to function on its own. It must be written in layman's terms so that anyone, including the individual and their natural supporters like pastors, friends, or neighbors, can understand and implement it during a high-stress moment. Responding to a crisis. Always know your consumer's crisis plans by heart. After a crisis occurs, the plan must be a living document. Review it to see what worked and what didn't. Most importantly, ensure that all critical information, especially medications and emergency contact numbers, it's current and it's accurate. Past issues. During an active crisis, we must refrain from discussing past issues. We operate in the here and now. Bringing up old grievances only adds fuel to the fire. Our sole focus is to defuse the crisis and stabilize the immediate situation so that the individual is safe and can eventually return to a state of equilibrium. 3 abilities affected by crisis. Finally, always remember that a crisis targets 3 specific areas of an individual's functionality. You will notice a decline in their overall coping ability, their ability to listen or communicate rationally, significant changes in their emotional equilibrium. When you recognize these 3 areas are impacted, you know you are dealing with an active crisis that requires your full, calm, and professional support. Healthy crisis coping. Techniques for healthy coping. When supporting someone in crisis, your approach is your most important tool. We promote healthy coping by active engagement. Listen with genuine concern and get a clear picture of what is happening. Focus on the here and now, the present source of stress, and encourage the person to express their feelings. Breaking it down. Help the individual gain an understanding of the crisis by breaking the problem into manageable bits. We make the overwhelming feel actionable. Validation and respect. Gradually help them accept the reality of the situation while emphasizing that their reaction is normal. Always communicate with respect, empathy, and a non-judgmental attitude. Professional boundaries. Avoid the temptation to offer false assurance or to encourage blaming others. Action. Finally, work to determine available resources and implement a collaborative plan. The philosophy of crisis planning. What planning is and isn't. It is critical to understand that crisis planning is proactive. It is the development of flexible supports that lessen an individual's vulnerability. What it is not. A plan for physical management or strategy to control someone's behavior. What it is. A process that respects the uniqueness of the individual. It is about listening to determine what leads to feelings of discomfort. The customization. A good plan considers modifications. Environmental is adjusting noise, light, or temperature. Social is assessing group sizes or dynamics. And routine is adjusting staffing or activity hours. Ultimately, the plan must include the strategies the person themselves identifies as successful and clear. Respectful steps for how to proceed when a situation is no longer safe. The role of staff and collaboration. Your role and inclusion. What is the role of support staff? It is to watch, look, and listen. We must understand what makes a person feel vulnerable and have open, honest conversations about how they react when angry or insecure. Then we plan with them, not for them. Never leave two groups out of this process. Number 1, the person being supported. Their voice is the most important. And number 2, all other support staff. These are the people on the front lines who hold the true picture of daily experiences. If they aren't part of the planning, the plan will not work. Practical execution of planning content. The mechanics of the plan. What is essential to know? Triggers. What causes symptoms? Is it weather, medical issues, or routine changes? Or behavioral indicators. What are the early warning signs like pacing, reduced sleep, or mood changes? Or the strategies. We must have proactive interventions to prevent the crisis and reactive interventions for when symptoms manifest. And also the contingencies. We must know who in the community can help keep the consumer safe. When writing these plans, ask, what soothes them? Who is best to intervene at home versus work? How do they want to be involved? And always maintain an accurate, up-to-date list of medications and the prescribing physician. Response, linkage, and follow-up. Procedures. Finally, let's talk about our post-crisis responsibilities. There's a first responder. This is the designated primary provider who has access to the plan at all times. Then, linkage and follow-up. Once stabilized, we determine the level of ongoing contact needed. This includes coordinating with mental health providers or case managers and conferring with the family or support network to see if the response met the client's needs. We also have continuous improvement. Use what you learned to revise the crisis plan. It is a living document. And there's reporting. Remember, report the crisis to your supervisor immediately and ensure An agency incident report is completed within 24 hours.